Bismillahirrahmanirrahim. Today is my topic, urinary tract infection. So it's a very important and interesting topic. I will try to make it easy and understandable for all of you. So we will start. The urinary tract infection, in this I will try to, all participants will understand about the definition, the types, classification, causes, and the risk factors, investigations, management, and preventive measures. One by one, I will explain. First, we start from the definition. Urinary tract infection is an infection in any part of the urinary system. Urinary system includes kidneys, ureters, bladder, and urethra. And most infections, UTI infections, involve the lower urinary tract, which are the more common and less serious or less severity. And the upper urinary tract infections, less common but more serious and with more severity. Women are at greater risk of developing UTI than the men or males, due to the reason is the short urethra in females. So I will tell about this adults age, the 20 to 50 years. UTIs are 50 times more common in women as compared to the males. In women, this age group between 20 to 50 years, most UTIs are involving our lower urinary tract, and these are the cystitis and pyelonephritis. In men, the most common UTIs are urethritis, prostatitis. One more thing, we can divide our UTIs in lower urinary tract infections and upper urinary tract infections. I will tell in the next slides through diagrams. I will explain. But after 50 years, more than 50 years age, the incidence of UTI increases, but the female-male ratio decreases because of the prostate enlargement and other instrumentation in males. So I will little bit explain in this diagram our normal anatomy. We will divide the UTI in the lower urinary tract and upper urinary tract. The lower urinary tract includes the bladder, urethra, prostate, and upper urinary tract, this includes the kidneys. In this diagram, we can see a little bit better. The lower urinary tract, bladder, urethra, prostate in men, and the upper urinary tract include these kidneys. So now I will come to the etiology and causes of the UTI. The most common cause in general, we can see the 80% of cases, the UTI, the common cause is the bacteria E. coli. It includes the general 80% or 75 to 95% of the cases. Other organisms includes Klebsiella, Proteus, Pseudomonas. They are the gram-negative. And in gram-positive bacteria includes Staph saprophyticus, Enterococcus faecalis, and Streptococcus agalacti, which are these are the less common. And if in hospitalized patients, E. coli accounts for about 50% of cases, the other gram-negative species account for the 40%, and the gram-positive are very less common and account for 10% cases only. This diagram just showing the pathogenesis of the UTI, how the bacteria colonize and ascends from urethra to bladder and bladder to ureters and kidneys. In this next slide, now I will describe the sign and symptoms. If we, I will start from the lower urinary tract infection, UTI lower urinary tract, which includes the urethra and bladder. The infection of urethra is called urethritis, and the infection of the urinary bladder is cystitis. These are the lower urinary tract UTI. In this, the sign symptoms in the cystitis, we have this dysuria, frequency, urgency, and suprapubic tenderness. In case of the urethritis, we have the same symptoms, but with the urethral discharge. And if the kidney is involved, this we say the pyelonephritis. And in this the pyelonephritis, this is the more severe infection in the UTI. But in this the pyelonephritis, we have the high-grade fever, nausea, vomiting, with the flank and loin pain. We can classify this UTI into three categories. First, due to that, the tract, that is the lower tract UTI or upper tract UTI. The one other classification is uncomplicated UTI and complicated UTI. And the third one is this one is according to the presentations, symptomatic or asymptomatic. So these are the three categorized classification: symptomatic, asymptomatic, uncomplicated, complicated, and the first one is the lower urinary tract infections or upper urinary tract infections. Uncomplicated UTI usually considered to be this involve the lower urinary tract or these cystitis or pyelonephritis that occur most commonly in the women, but they are not in the other complications, not pregnant, no other postmenopausal. So these are the uncomplicated UTI. Complicated UTI can occur at both of age, male or female, at any age. And if we considered UTI as complicated UTI, if the patient is a child, patient is pregnant, or patient has the following few risk factors: structural or functional urinary abnormality and obstruction of urine flow, or comorbidity that increases risk of acquiring infection. For example, the immunocompromised patients or diabetic patients, or recent surgery or the instrumentation, for example, the catheterization or other procedures of urinary tract. So these patients we considered as the complicated UTI. And without these, the uncomplicated UTI. Now come to the complications of UTI. It includes if the patient, this the recurrent infections, or the acute or chronic kidney infections, pyelonephritis due to untreated UTI, or in the pregnant woman. The complications include the recurrent infections. Recurrent infections, we can explain this the two or more than two infection in 6 months, or three or more than three episodes of UTI in 1 year. When we say the recurrent, or if the pyelonephritis, untreated pyelonephritis lead to acute or chronic kidney infection, or more severity the pyelonephritis, it can go acute renal failure or damage to kidney. And in pregnant women, if untreated UTI, it can cause the low birth weight baby or the premature delivery. There is the urethral narrowing in the stricture formation due to the recurrent urethritis. Patient seen in this urethritis due to the chlamydial or gonorrhea infection. The other is the complication is the sepsis or the perinephric abscess. If patient is treated but or no benefit in the pyelonephritis cases and perinephric abscess formation or septicemia, these are the complications. Now I will come to the diagnosis, how we diagnose the UTI. To depend on the site, upper UTI or lower UTI, or simple or complicated, uncomplicated or complicated. So it depends on this, we can go for the diagnosis now. Before I told you the lower UTI and lower urinary tract infections, they are more common but less severe. For the diagnosis, the urine midstream urine sample should be taken, and we will see in the presence of the WBCs or the pus cells. If the WBCs more than five WBCs, or the WBCs more than 5 to 10 in the per high power field or per millimeter square. So these are the diagnostic. If the patient is bedridden, old age, or in children, we can take the urine sample through catheterization. If the suspicion of the sexual transmitted disease, we can take the urethral swab also. In cases of this urethritis, chlamydial infection or gonorrhea. For the simple cases or uncomplicated cases, the urine analysis are sufficient for the lower urinary tract infections and uncomplicated. We can go for the urine analysis and start the treatment. But if the patients are complicated, we can go for the urine cultures. For urine culture, I will explain which patients we will go for the urine cultures. In pregnant women, postmenopausal women, in men's, we will go for urine culture. Pre-pubertal children, and the patient with urinary tract abnormalities or recent any procedure to urinary tract. Patient with immunosuppression or with any other chronic illnesses. Patients whose symptoms suggest pyelonephritis, so we'll go for the urine culture, and patient with recurrent UTI. Now, which patients are needed for the imaging? In simple cases, no need of the uncomplicated simple cases, no need for the imaging or any CT scan or ultrasound. But the complicated cases or falling cases, we will go for imaging, include this ultrasound, CT scan, cystourethropy, cystoscopy. Children with UTI, so they often they require the ultrasound. Most adults do not require assessment for structural abnormalities unless the following occur. The patient has more than 2 episodes of pyelonephritis, complicated infections, or the renal stones suspected, then we will go for this cultures, for this imaging, sorry. If there is the painless gross hematuria or fever persists for more than 2 to 3 days. Now we will come to the management. As before, I told you the lower urinary tract infection, urethritis, cystitis. First, I will start from the urethritis. In the sexually active patient with symptoms are usually treated, and this regime for the urethritis. In urethritis, most commonly this involve the chlamydia and gonorrhea causes this urethritis. In this, the urethritis, we will go for the ceftriaxone 250 to 500 milligram intramuscular with 1 gram azithromycin per oral once dose. Or the other regime, doxycycline 100 milligram BID for 7 days, plus this azithromycin 1 gram per oral. In the cystitis, if the cystitis is the uncomplicated, the first line treatment is nitrofurantoin 100 milligram BID for 3 to 5 days. One more thing I will explain. In the uncomplicated cases of cystitis, the lower urinary tract infections, the treatment is for 3 to 5 days, or some books 3 to 7 days. But in complicated or pyelonephritis, the treatment plan 7 to 14 days. So in cystitis, this nitrofurantoin, we can give 100 milligram BID for 3 to 5 days. Or the other option is this trimethoprim sulfamethoxazole BID for 3 to 5 days. In case of the acute pyelonephritis, we will give depend on the patient is for discharge or for admission. If patient is for discharge and we will give the oral antibiotic in pyelonephritis, we will give the ciprofloxacin 500 milligram 12 hourly for 7 to 14 days. And second option is the trimethoprim sulfamethoxazole, the 160-800 milligram BID for 7 to 14 days. But this acute pyelonephritis this uncomplicated. If the patient is admitted, then we can give the ceftriaxone 1 gram for 14 days. In pregnant women, we will see the patient is symptomatic bacteriuria or asymptomatic. In both cases, in pregnant females, we will treat with antibiotics if the patient is symptomatic or asymptomatic bacteriuria. And urine culture should also be done. just the detail of this culture. We first antenatal visit, we will do the first culture of bacteriuria, then confirm with the second urine culture. And with the asymptomatic bacteriuria, we also treat with antibiotics. But in if patient woman not pregnant, asymptomatic bacteriuria, we will not treat with antibiotics. In males, UTI, we will see this patient as complicated because they can result from any anatomic or functional anomaly or the instrumentation of the urinary tract. The other conditions like the prostatitis, chlamydial infection, and epididymitis should be considered in men as a differential diagnosis with acute dysuria, frequency, and other appropriate diagnostic. In all men with symptoms of UTI, a urine sample should be taken for culture. Now the treatment in men, the ciprofloxacin is are also indicated and more preferable. But if the is the prostatitis, we can go for the 4-week course with the symptoms of the prostatitis. If the few patients on the patients on catheter, we will not use dipstick testing to diagnose UTI in a patient with catheters. Do not treat catheterized patients with asymptomatic bacteriuria with an antibiotic. And we will not go for the prophylaxis. The prevention, drink plenty of the liquids, especially water. One cranberry juice also reduces this chances of UTI. And one other, for hygiene, wipe from front to back, not from back to front. Postcoital voiding also reduces the chances. And other, this the female, the birth control methods, use of condoms, reduce use of condom. This also the go for this prevention. In this, if the female has the recurrent UTI, that the more than 3 UTIs per year, we will go for the prophylaxis also. One is the continuous prophylaxis, other is the intermittent. Continuous prophylaxis for the recurrent UTI, commonly we will go for the 3 to 9 months. The average is the 6 months prophylactic therapy, either with this trimethoprim or nitrofurantoin. One more thing in the children, if the patient age is infant is less than 3 months and the suspected UTI, will go for this IV antibiotics and refer the patient. And 3 months older UTI, we will use this amoxicillin or augmentin. This is the summary. Just treat non-pregnant women with nitrofurantoin 3 to 5 days, uncomplicated cases, and treat pregnant women with antibiotic of the patient asymptomatic bacteriuria. And in male patients, urethritis will consider the sexually transmitted infections with prostatitis. And we will not give this prophylaxis for adult with catheter, and do not treat asymptomatic bacteriuria. So just for the in the summary, first the definition I described, then the types of the UTI according to the track, severity, presentation. Then we go for the etiology, and then the management, and with the investigations. Okay, thank you.